practicing very focused in the CKD space, insulin resistant, and they just cannot manage their blood sugars very well. A ketogenic diet, and he was starting to report these results. He would go to conferences, report on his results.
Hi everybody, welcome to the Kidney Coach YouTube channel. I'm naturopath Fiona Chin, co-founder of Kidney Coach Kidney Disease Solution and Ketogenic, our range of nutraceuticals designed for people diagnosed with chronic kidney disease and the conditions that go with them. And I'm joined again today by expert in the field, Jessianna Saville. So walk me through the ketogenic diet and what you've seen it do with kidney disease and with diabetes.
Yeah, so I've had quite a journey with this as a professional, because again, my training is quite conventional. And when I started practicing very focused in the CKD space about 8-10 years ago, we were just really common, like carb counting, count your carbs, make sure you have protein or fat with your meals, so you kind of level out the curve on your blood sugar. Like that is the conventional advice. And over the last couple of years, because we've been more engaged in the ketogenic community because of our work with PKD, I've really seen some interesting things that are happening in that area. Now, I think absolutely there's a couple of things to acknowledge here. People that are coming from a regular, like ordinary American diet, and they shift towards a more plant-focused diet with diabetes, they do see a pretty solid improvement in their blood sugars because you start getting a lot more fiber. And that is really a huge key with diabetes. It doesn't matter there's controversy within the keto world. Otherwise, for the most part, if you look at a lot of the experts that are in this space of managing blood sugar, fiber is key, right? Fiber is really, really key. So you can get kind of this initial benefit, and for some people it's enough that that's all they do. They focus more plant focused, and they really get a bump in their kidney function, better A1C, their diabetes more managed, and they're super happy, and that's great, right? However, there are other people who maybe they switch more plant-based and they have diabetes, and now they feel like they're on kind of this blood sugar roller coaster, or they feel like unsatisfied all the time, or they're just not feeling good, or they're just not getting an outcome, period. We've also seen that with a ketogenic diet, and I'm going to tell you a couple of things that shifted my brain on this, because I was not in the space of using ketosis outside of PKD for a long, long time. But for people that are really, really insulin resistant and they just cannot manage their blood sugars very well, a ketogenic diet can be such a godsend to them. It works so well. And it's interesting because if you start looking at some of those, whether it's practitioners or companies that are using ketogenic diets, they are reporting some pretty interesting and positive outcomes on the kidney space, or secondary outcomes. And I'll give a couple examples of this in the ketogenic space. And these are ketogenic diets that are not modified for protein. So they actually probably are a little bit higher in protein, and yet they're having pretty positive results in the kidney space, which is really interesting to me. So one company you can look at, it's pretty big. They've got a pretty good amount of research. They got a big old grant right now that they're looking at. This is Virta Health. And they use ketogenic low-carb diets, and they're getting phenomenal results just with diabetes and some good secondary outcomes with kidney disease. The place where this really changed my mind, or the conversation, was one that I had with Dr. David Unwin, and he has, we were at a ketogenic work group together, and I got to pick his brain a whole bunch. And I know I've shared a little bit about him. I really admire him as a professional, but he was telling me that when he started using ketogenic diets with his patients, I can't remember, 10 years ago or so, I can't remember how long ago, in his clinic, and he was starting to report these results, he would go to conferences, report on his results, talk a little bit about it. And he said the dietitians would stand up and lambaste it. And they'd be like, how can you do that? You're going to knock out everyone's kidneys. You can't be using ketogenic diets with them. And, kind of just really not super nice about it. And he's like, well, I got all the data, so I'm gonna just go back and run the data. Maybe I'm wrong, I don't know. So he has all the data, and he went back and ran it. And lo and behold, and you look at his study, real world, right? So it's not a clinical trial, but it's just like, here's what I did in my clinic, and here's what happened. He actually had, again, on a non-protein controlled diet, some pretty positive positive results on the kidney function. And these were for higher, CKD3 or above, which is important to note.
Yeah.
But he was seeing some positive kidney outcomes by using a ketogenic approach. And I really pondered on that quite a bit after talking with him and just thinking like, well, what are we wrong about? What are we pushing and encouraging people to do that maybe we need to step back from or need to implement more? And I know for us, as we've used ketogenic approaches with our patients with diabetes, that we have seen some pretty solid results at this point where their GFR does go up. They get off their insulin. They, they see some improvement in their kidney function. And so I think it's a really important option for patients to have.
All right, remember to hit subscribe and like. That means that you'll get notified anytime we put out a new video. If you want to know more about us, head to www.kidneycoach.com. You'll find all our products and links to our Facebook page, Instagram, and everything else that we do on social media. But you'll find us all on Facebook/kidney disease, same with Instagram. Jess, thanks again. Always value you. And to everyone listening, thanks for being part of our community. We hope you found this useful. Till next time. Bye.
Bye-bye.